Now, this is our interview with Dr. Allan Pamba with Glaxo-Smith-Kline, who elaborates on the importance of access to medicine.
One of the things that we are seeing is a greater role for the private sector to be able to contribute to driving social impact, reaching some of the harder to reach patients. We are also seeing a rise of innovation, the mobile phone platform, so new innovations that are allowing Africa to leapfrog some of the hurdles that before will have taken much longer to achieve. So leveraging the mobile phone platform as an opportunity to increase vaccine uptake, as an opportunity to address issues around counterfeit of medicines, etc.
Let's talk about these barriers.
The statistic I'll give is that Africa has to solve 24% of the global health burden with just 1% of the global health budget and just 3% of the global health workforce. The challenges are huge. Awareness, many societies have lower literacy levels, so they're not able to read labels on medicines, for example. Because the economies are weak, a number of big companies have not focused on registering a wider variety of medicines in this environment, so availability is limited. Acceptability, in the past we've not really focused on developing products that are acceptable to this environment. So people don't want to buy, a pack of 50 because they live on $2 a day. They want to buy a pack of 2, and understanding that as you innovate and develop products for that environment. Price as a challenge. I think it's important to be able to try and understand what's the right price point for the products that we get in the continent that allows us to maximize on the volume, which means we're able to break even, because for me that's important for sustainability purposes, and also able to reach the maximum number of people. All these are challenges that we have to grapple with, and in the context of very limited infrastructure to reach those patients.
We know that the role of the pharmaceutical company in general is to make medicine that patients will need to feel better. But when we look at how complex this issue is, the price of drugs, we're looking at some policies, availability of drugs, and et cetera, et cetera. What do you see as the ultimate role of the pharmaceutical company in addressing access to medicine?
I think I'll probably start by saying, for those who are not aware, Glaxo-Smith-Kline has led in a very objective index looking at the top 20 pharmaceutical companies and the access to medicines achievements. We've led on that index 3 times now, which I think is very encouraging for me, certainly as a physician from Africa, working for a company that seems to be in the right direction for that. What's the role of the industry in this space? I think it's evolving. I think we are getting a bigger role at the moment. So being a healthcare company, there is an obligation to reach not just those who can readily afford to pay and pay a premium, but everybody really, because in many societies, health is looked at as a universal, right. And what we are seeing, certainly from our company's perspective, is need to have innovative business models that allow you to reach the harder to reach patients. In the case of Glaxo-Smith-Kline, we have set up a business unit that brings our business in the 50 least developed countries under one umbrella, with a focus on volume as the measure of success, rather than just profit. And that is allowing us, as we look for that volume growth, to begin to take on board those challenges that have bedeviled many governments to reach the last mile patients. So in looking for that volume growth, there's those barriers to access which traditionally were seen as problems for government and maybe the NGO community, begin to become our problems as well. So we want to partner with governments, the NGO community. We want to partner with other sectors to try and break down those barriers so that we can reach those last mile patients and achieve the volume ambition.
When it comes to price and medicine, we all know that people always complain, at least many people do complain about the price of medicine. Of course, pharmaceutical companies have to make profit. Yet some people in low-income countries cannot afford these drugs.
Just to give context to this, it takes 15 to 20 years to develop a new medicine at a budget of about $1 billion on average, and more or less the same for vaccines. Now, that's a huge investment which the originator pharmaceutical companies undertake. And most people will not start that journey unless they're clear on how they're going to recoup that investment. Investors, generally will expect that. That doesn't mean that you can't start the journey and that's where partnerships come in. And it also means, it doesn't mean that you can't complete that journey. And that's where innovative business models come in. So in the case of Glaxo-Smith-Kline, we recognize where the 50 least developed countries are. We don't think that they present today an opportunity to have a business doing fantastically well in terms of cash returns, but they present an opportunity to do a business at the base of the wealth pyramid that has fantastic social impact if you find the right model and if you find the right products. And that at all doesn't imply, any compromise on quality, but it implies, products that fit with the needs of the continent much better, in terms of controlling costs of development, in terms of controlling the cost of distribution and getting the products to the patients. So I believe that it's totally possible for the industry to have a business sustainable presence in developing countries and be able to reach many more people than we are reaching today with quality products.
And that was Dr. Allan Pamba with Glaxo-Smith-Kline.